Thyroid cancer symptoms are usually very subtle and may not be noticed or recognized until very late. In fact, almost everyone with thyroid cancer does not recognize that they have slowly developed some symptoms with the associated slow growth and progression of most thyroid cancers. Most thyroid cancers are diagnosed after a person has undergone some type of X-ray, such as a CAT scan in the emergency room, and a lump is noted in the thyroid gland or a lymph node. Top 5 symptoms of thyroid cancer. Thyroid cancer. Symptom #1, lump or mass in the neck. Thyroid cancer symptom #2, sense or feeling like you need to swallow something. Thyroid cancer symptom #3, a cough that won't go away. Thyroid cancer. Symptom #4, change in your voice. Thyroid cancer symptom #5, fatigue. Thyroid cancer. Symptom #1, lump or mass in the neck. When thyroid cancer symptoms do exist, the most common symptom is a lump or a mass in the neck. This lump can be noted from a mass within the thyroid gland itself, or when a thyroid cancer has spread to a lymph node. Thyroid cancer lymph nodes are usually not painful whatsoever. When a thyroid cancer lymph node is painful, the most common diagnosis is a special type of thyroid cancer called medullary thyroid cancer. A case in point. A healthy 35-year young woman is having lunch with a friend, and this friend notices a lump in her neck. Expert thyroid cancer surgical care is required to achieve the best cure rate and lowest complication rate for thyroid cancer. All important structures are spared, and only the thyroid gland and its cancer and those lymph nodes at risk of having thyroid cancer are removed. It is critically important for people to understand that in nearly 50% of thyroid cancer surgery, the diagnosis of thyroid cancer is not known until final pathology has been obtained. In clearer terms, almost half of people which possess a thyroid cancer do not know they have a thyroid cancer at the time of their initial operation. They went in to have a thyroid nodule or thyroid growth removed, and several days after the operation, the pathologist diagnosis is that of a thyroid cancer. The surgeon didn't know it was cancer until a few days later. And this can be a problem because if the surgeon knew it was cancer ahead of time, she may have performed an appropriate operation to make sure all the thyroid cancer was removed. Thyroid cancer symptom #2, sense or feeling like you need to swallow something. The second most common symptom of thyroid cancer is a change in swallowing or a feeling like something is in your throat when you swallow but it just won't go down. This thyroid cancer symptom is caused by special nerve endings in the swallowing tube, esophagus, called baroreceptors. These special nerve endings sense pressure. However, these special nerve endings cannot tell whether the pressure is being created inside the swallowing tube or from the outside of the swallowing tube being pushed in. Because the thyroid gland often lays right on top of the swallowing tube, a thyroid cancer within the thyroid gland will produce pressure on the esophagus, producing the thyroid cancer symptom of feeling like you need to swallow something. Thyroid cancer symptom #3, a cough that won't go away. It is easy to dismiss a thyroid cancer symptom of a simple cough. Many other potential causes of a cough, without a cold, exist, including allergies, postnasal drip, and reflux of stomach acids. The cause of the symptom of thyroid cancer of a cough, which will not go away, is likely due to some form of irritation to the sensory or movement nerves of the voice box. This can be caused by inflammation or irritation of the nerves to the voice box by the thyroid cancer, or even due to direct or indirect pressure on these nerves or the breathing tube itself. Thyroid cancer. Symptom #4, change in your voice. An individual who presents with a symptom of thyroid cancer, which is a change in voice, is a later sign of thyroid cancer and an unfavorable one. Sometimes this change in voice can be very subtle and may only be noticed by the person who is being affected. Any change in voice should be a call to action and an appropriate evaluation for a thyroid cancer undertaken. If a person has hoarseness or loss in voice, this is truly one of an urgent matter for expert evaluation and likely surgery for the thyroid cancer. In adults, although vocal cord paralysis may be caused by other issues, hoarseness, or change in voice, caused by a paralyzed vocal cord, must be considered thyroid cancer until proven otherwise. Thyroid cancer. Symptom #5, fatigue. Fatigue is a common symptom of thyroid cancer but often overlooked due to the complexity of other potential causes of fatigue. In most circumstances, individuals with thyroid cancer usually present with normal production of thyroid hormone. Although almost all doctors examine thyroid function in the evaluation of a patient with a potential thyroid cancer, those thyroid functions are also almost always normal. The reason that thyroid cancers can produce a symptom of fatigue is not clearly understood. In fact, this relief at times can be quite amazing. Bonus thyroid cancer symptom #6. Uncomfortable pressure sensation in the neck.